the reason this drug causes kidney problems, we don't know exactly, but we feel that the CD22, that there's something like CD22 in the kidneys that the drug binds to non-specifically. But if we can keep the urine from being very concentrated, if we can keep the drug in the blood not so concentrated, then we feel that patients can tolerate it perfectly well. The drug causes a syndrome in addition called capillary leak syndrome. This is an important syndrome that's caused by poking holes in the blood vessels. And the way the drug works, as I said, it binds to the surface of the malignant cell, goes inside, and then once inside a place called the cytoplasm, the drug can kill the cell. Now, when you have lots of molecules of the drug in the blood vessels and the drug needs to get out of the blood vessels, then it can it can go through the cells lining the blood vessels. Those are called endothelial cells, and those are living cells. And so it can kill some of those cells. And so as it's going through those cells and it kills those cells, it can cause leaking. It can sort of poke holes in the blood vessels, which isn't necessarily a bad thing. We actually hope that the drug gets out of the blood vessel because then it can kill some of the hairy cells that are outside the blood vessels. But what it does is it causes a little bit of leaking. And so patients will have leaking of blood, of fluid and proteins from the inside of the blood vessels out. They won't lose blood, but they'll lose fluid and proteins. And so it's important for patients to drink in order to keep from being dehydrated. And so what we find by trial and error is that if patients are drinking about a cup of water an hour, which we find is very manageable, that they can keep from being dehydrated. But the trick is that even goes at night. And so we try to average out a cup an hour so that patients, if they're sleeping for a couple, 3 hours at a time at night, they'll get up and drink about 2 or 3 cups of water. And what that will do is keep them from being dehydrated. And we kind of liken it to a leaking bucket. If you have a bucket that has a few tiny holes in it, it's constantly leaking. And if you don't do anything to fill up the bucket, over a certain period of time, that bucket is going to become empty, or it's going to become almost empty to the point where that's going to be similar to someone being dehydrated. And so if you drink a little bit of water at a time, you can keep that bucket full, even though it's leaking. And that's what we explain to patients nowadays, to try to get them to understand that it's a gradual process. You can't just drink a gallon of water, or you can't really rely on getting a liter of IV fluid right away, because that's really going to overflow the bucket. And what we see then is patients may have some difficulty breathing, or they may have some edema, some swelling. Did you remember having any swelling or having shortness of breath or having those kind of side effects along the way?
I do not remember any swelling and shortness of breath. Like I said, the drug was almost side effects free for me.
Mm-hmm. And so, fortunately, some people have that experience too, but we find that many people do have swelling, they have edema, and oftentimes they notice it. Let's say if they've gone through the 7 or 8 days of the treatment's given every other day for 3 doses, and we know that patients on day 8, if their labs look okay, then they're going to be fine. There's a syndrome that patients can get into that combines a decrease in kidney function, which goes along with an increased creatinine in the blood, with decreased platelets. And that combination we call hemolytic uremic syndrome. We see this in a low percentage of patients with Moxie, less than 10%. It seems like it's a syndrome called HUS that you see with a patient who might have a bad hamburger and they end up on dialysis, getting plasmapheresis. This is not the kind of side effect that we see with Moxie. With Moxie, patients don't need anything special when they have that side effect. Unfortunately, you didn't have that side effect, but when patients get it, they only have to stop the drug. They can continue drinking water, and we just have to wait for it to resolve. And really, the worst thing about that side effect is it means you can't continue with the Moxie. And when we look over the patient's history who've had those side effects, oftentimes we can see that they weren't really keeping up with the drinking, and they weren't able to drink for one reason or another. And what we found on the phase 3 trial of Moxie, the trial that started after your trial finished, is that sometimes patients really didn't feel like drinking because they had some nausea or they had some fever, so that was making them dehydrated also, or they were getting a headache. And what we found is that those 3 symptoms could be rapidly eliminated by taking a steroid called dexamethasone. And a very low dose, 4 milligrams orally, would take away that symptom within an hour or two or a few hours, and then patients could get along with drinking fine after that. So that's what we recommended doing. And in your trial, the phase 1 trial of Moxie, we found that only 2 out of 49 patients had this syndrome called HUS, and it was very mild. In the phase 3 trial, we had a different lot of drug. We found that of the first 9 patients that we treated, 3 patients had the HUS toxicity. And at that time, we instituted the precautions of drinking a cup an hour, and also taking the dexamethasone if headache, nausea, or fever prevented patients from keeping up their fluids. And so of the next 17 patients, only 1 patient had a very mild case of HUS. So I don't think that we can prevent HUS with a drug 100%, but I think we can get very close to a very low percentage by these precautions, which are simply to drink plenty of fluid gradually, a cup an hour approximately, not to go more than 2 to 3 hours at night without getting up to drink more water, and obviously to urinate. And if one has nausea or even a queasiness feeling or headache, or they have fever, we recommend taking a 4 milligram dose of dexamethasone. It's not every patient that will need that. We found that only about half the patients need it, and maybe only 2 or 3 of the or only 1 or 2 of the 3 doses that are given per cycle of the Moxie. But we think that this is really important, and that can prevent patients from having side effects